Andies Group 1, Scope of Practice. What is scope of practice? Scope of practice describes the services that a qualified health professional is deemed competent to perform and permitted to undertake, in keeping with the terms of their professional license. The nursing scope of practice and the standards of practice consist of a who, what, when, where, why, and how. Looking at the who, it is comprised of registered nurses and advanced practice registered nurses. What? Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, facilitation of healing, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, groups, communities, and populations. The when, whenever there is a need for nursing knowledge, compassion, and expertise. Where, wherever there is a patient in need of care. The why, the profession exists to achieve the most positive patient outcomes in keeping with nursing's social contract and obligation to society. Looking at the scope of practice, because the U.S. Constitution does not regulate nursing practice, it is the job of the state to maintain public order, health, safety, and welfare. Some of the goals of nursing leaders were to legitimize the nursing profession, alleviate the quality of professional nursing, in turn reducing the number of hired nurses, and to also raise the educational standards of nursing schools. North Carolina is where the first nurse registration law was legislated. This law was put into place to first protect the title of the nurse and to expand the practice of nursing. Later in that year, New Jersey, New York, and Virginia followed suit with their own registration laws. However, the scope of practice was not defined until 1938 in New York. 32 years later, by the 1970s, all U.S. states required licensure for registered and practical nursing practice. Every state has their own Nurse Practice Act. However, all Nurse Practice Acts include and must definitions, authority, power, and composition of a board of nursing, educational program standards, types of titles and license, protection of titles, requirements for licensure, and grounds for disciplinary actions if there are violations. Political importance of the scope. Factors that made this topic politically important. The beginning of state actions towards professional nursing. You have to look at the U.S. Constitution, the 1903 North Carolina, 1938 New York, and the Nurse Practice Act, which I just reviewed. Concepts of scope of practice. Every position in healthcare has an established scope of practice to determine what that practitioner can and cannot do. However, it is important to address how the scope of practice changes in the event of public health emergency. In that case, the scope of practice is modified to meet the healthcare's demands. There are a few concepts that must be addressed regarding modified SOP. Authorities to modify the scope of practice. Every state has their own protocol regarding the modification of scope of practice and when it is in effect, many of which are only in effect until the emergency is expired or canceled. Factors influencing modified scope of practice in emergencies. They are permitted activities and practitioners undertaking them, medical control and supervision, and training. Concerns with modified scope of practice. Adequate training and the liability of the practitioners that are completing these. Political implications. Nurses have the potential to profoundly influence policy and politics on a global scale because nursing is the largest medical profession in the healthcare setting. When nurses influence the politics that improve the delivery of healthcare, they are ultimately advocating for their patients. Unfortunately, nurses have historically had little involvement in policy that affects healthcare delivery. Nurses should be leading the way in redesigning the healthcare system, but in order to do so, they must be skilled in patient care as well as in interdisciplinary teamwork, informatics, and technology, implementing evidence-based practice and quality improvement while teaming up with other members of the medical profession such as physicians. Nurses can obtain formal training in politics, become involved in city councils and committees, or even run for local office. However, nurses need support in order to effect change, and that support starts at home. Families and friends of nurses need to encourage political activism. Nursing schools need to include healthcare policy education as part of the curriculum, as well as encourage some level of political involvement from nursing students. Speaking of students, a great way to get involved in school is becoming part of your nurses association and also holding a position while you are in school, such as president, vice president, treasurer, secretary, or even activities coordinator. Political actions. According to an article from the American Nurses Association, they believe nurses and political actions go hand in hand. This comes from Trossman, 2004. Nurses instinctively advocate for their patients in their workplaces and in their communities, but legislative and political advocacy is no less important in advancing the profession and patient care. The American Nurses Association Political Action Committee are considered a transparent and mainstream way to help fund increasingly expensive political campaigns and gain widespread political involvement from within association membership. They are only used for political purposes and represent the thousands of registered nurses who support the PAC. The American Nurses Advocacy Institute has created a well-prepared and connected body of registered nurses who are equipped to influence policy at local, state, and national levels. Actions include helping to establish their legislative and regulatory priorities, recommending strategies to advance policy issues, and educating members about political realities, as well as advancing ANA's political agenda. Again, that is a strong suit for you to try to become a part of your American Nurses Association as early as school. The ANA programs are designed to accomplish introducing the relationship between the advocacy process and policy change, identify criteria and methods to conduct a political environmental scan, describe the effective strategies for creating and sustaining policy change, and explore networking and coalition building for effective advocacy. We have to remember that number one, our patients are our number one priority, and we must advocate for them above all. Political barriers. Throughout the years, political barriers have limited nurses, the ability to contribute to the healthcare field, whether they work in acute care, public, and community health settings. Many who are covered by health insurances under the Affordable Care Act has been recognized as a serious barrier for overly restrictive scope of practice. Due to all the regulations many states have, it prohibits many nurses to not be able to perform they have been trained to provide. All health professionals should have the ability to practice to the full extent of their abilities within their scope of practice for the benefit of the patient. All nurses are highly trained and able to provide a broad array of services, but due to barriers from state laws, federal policies, outdated insurance reimbursement models, and institutional practices and culture all prevent from performing within their scope of practice. According to the policymakers, they are being guided by the National Council of State Boards of Nursing, Model Nursing Practice Act, and administrative rules in the effort to change the scope of practice laws. New policy and/or research that is associated with the scope of practice. New policies are made all the time to ensure scope of practice is maintained through many different medical professionals that deal with patients. A great tool for determining scope of practice of your degrees and other individuals. They differ between states and hospitals. Most new policies in Tennessee are directed toward physicians and nurse practitioners. Nurse practitioners must have a physician supervising. Nurse practitioners may prescribe Schedule 2 through 5 controlled substances upon receiving a certificate of fitness from the State Board of Nursing and adoption of physician supervisory rules. Scheduled narcotics may only be prescribed after consultation with the physician. And again, this is tied to the Tennessee scope of practice policy. Recent changes, policies to Nurse Practice Act, State of North Carolina. Updates to the North Carolina Nursing Practice Act became effective October 1st, 2019. Self-reports regarding arrests or indictments should now be made to the North Carolina Board of Nursing within 30 days for any of the following. If you are found to have a felony arrest for indictment, any arrest for driving while impaired or driving under the influence, and or any arrest or indictment for the possession, use, or sale of any controlled substances. It is also important to note that failure to respond to the board's inquiries in a reasonable manner or time regarding any matter affecting the license of practice nursing is reason for disciplinary action by the board. These new changes were brought about in the year 2019 by Donna McDowell White, RN, to protect the safety of the public and to enhance the efficiency of the board with operations. And again, before this October 1st, 2019, there was not a time limit within the Board of Nursing for 30 days to report any of this. Unfortunately, some claims went all the way to court and up to 2 years before the Board of Nursing obtained that somebody had either had a felony arrest, driving under the influence, or an arrest for the possession, use, or sale of controlled substances. Recent changes to policy with the State Nurse Practice Act in the state of Tennessee. Looking at public chapter number 744, which was established on April 18th of 2018. It did not, however, take effect until January the 1st of 2019. The statute allows a licensed entity to discretion or not suspend, deny, revoke a license in cases where the license has defaulted or become delinquent on student loans, if a medical hardship significantly contributed to the default or delinquency. In the end, if you are working at a healthcare facility and you become delinquent on your student loans, they can choose to keep you employed and not deny your license because of school-related stuff. Again, I feel like this is a very huge step up with looking at all the school debt we established during nursing school. Some nursing schools are more expensive than the other, but I do not feel personally that we should be unable to work and practice as a nurse as hard as we did in nursing school just because we were unable to pay our full amount of student loans at that time. Coalition. For or refuting the above listed changes to policies. Looking again here at the state of North Carolina. The recent changes that become effective in 2019 with regards to reporting felony arrest, driving while impaired, and arrest for the possession, use, and or sale of controlled substances would only impact practicing nurses that have a substance abuse problem that are trying to keep it hidden. I can only see that these individuals would be opposed to this new ruling. You now only have 30 days to make this public, and in that time, you have so much to deal with in other legal aspects. Again, I do not feel that any practicing nurse that has no concerns with this and or would not have any in the future dealings with any of this would have anything with refuting this coalition. People that would back this in your healthcare workers that do have some concerns with impaired individuals, feel unsafe, and or the healthcare agency that you work for as far as protecting their patients, which is their main responsibility. So again, people that have a problem with substance, for example, or maybe have had some of these come up in their past before getting a nursing license could maybe refute this, but I do not feel that agencies where you are hired would refute this at all. In regards, again, patient safety needs to be our #1 priority. Coalition for or refuting the above listed changes to policies. And again, this one is actually based on the state of Tennessee. The recent changes become effective on January 1st of this year, 2019. Any persons that have delinquent student loans would be 100% for this new change. Students that can come out of school and, of course, in the hole when it comes to a student loan debt. As students, we are not always able to come out of school and start paying our loans back immediately. If companies had to follow a strict law and not be able to keep you employed or employ you based on your student loan status, would there really be a lot of new grads with jobs, period? And again, we spoke on this earlier, but students coming out of school, we are already in debt in the hole, so this would not work for us. Any student loan grantors would not follow this law as they would keep recent students from being employed unless they were current with their student loans. So I do feel that any student loan grantors, of course, would refute this. They would want you to be able to pay them. However, it doesn't make any sense in the end because you would think they would want to make sure that you were employed so that you could pay them eventually. This would, in the end, make sure that they received monies properly to keep a nurse employed. And you can see a list of references, as well as we also have handouts to go with this PowerPoint presentation.